Hey y'all, what's going on? I've gotten a lot of messages and comments on here talking about how people would like me to post a video with the questions that I had for my console, so I decided I'm going to go ahead and do that. I've got them divided into 3 categories, kind of. So I'm going to go ahead and talk about all these. The first category I've got on here is like general questions. I wanted to see a portfolio of before and after pics, and they mentioned that I had to have some blood work done, so I asked what kind of blood work and then how much was it going to be, and was that something that they included in the price. And then I asked for additional costs for revisions. I also asked, what happens if I get sick right before surgery? Do you continue on with surgery, or do I have to reschedule it, or what? I also asked what complications have past patient encountered, and what is or was done as a countermeasure. I also asked about sensation in the nipples post-op, or was it purely cosmetic? And will they ever look normal or work again? Because I've seen some pictures, of post-op where the nipples don't quite look normal, and they told me that it'll take some time, but yeah, they should. I also asked about sensation in the rest of my chest, because some guys say that, sensation is severely lacking or not present at all. I also inquired about the infection rate, as far as, what is the infection rate? I'm sorry, this is pretty rough because I've got shorthand on here, so I'm having to form it into questions. And then my next category on here was the pre-procedure stuff. My big question was, is it better for me to work out as much as possible beforehand or not? And my logic on that was, if I work out as much as possible, maybe it can look as best as possible right after surgery, and it would make it a little easier for him to find the pec line, so that it would be easier to hide my scars. And then my reverse thinking on that was, well, if I'm huge when I go into surgery, I'm going to have to get even bigger to cover the scars and then maintain that size for the rest of forever. Which, I plan on maintaining it, but, we all get old and quit working out eventually, right? Another question that I asked was, how long beforehand do I need to quit smoking? And I also asked about things that I can do from then till surgery to minimize the negative consequences. I also asked about when do I have to stop the testosterone and why, and he was able to explain that to me. I also asked if there were any vitamins or supplements that I can take to help speed the healing process, or maybe help keep the skin elasticity at its best to avoid having to have revisions. I also asked, what medications do I not take before and after surgery, and what else do you recommend that I do to get ready? And then, I guess there's 4. But anyway, the third one that I asked about was, procedure details. Like, I asked for, a very detailed description of the procedure. And I also asked about scar placement. Did he intend to give me straight ones or curved ones? And then nipple placement. I also asked about some of the side effects of, the various medications and surgery itself. And I also asked him about the complication, potential complications or limitations of the surgery, what were the limitations as far as final results. I asked how long I would be in surgery, how long I would be in recovery, what was the likelihood of needing revisions, what pain meds were they going to give me, and were they going to give me that prescription day of or beforehand. And then the last topic I have divided into is the post-procedure stuff. What was the average healing time? What do you recommend that I use on the scars and for how long? And how long do I wear the compression vest, and what are the reasons and benefits of wearing it for that period of time? and is it beneficial to wear it longer than, he told me. I also asked him how long do I need off of work, and I asked him about the follow-up appointments and procedures. Another really big one was what will I need from whoever takes care of me, and what will Sam be able to help me with, or need to help me with, after I get released from the hospital. I also asked when I could drive, and if there was anything that I could do to help reduce the bruising. And then I asked if vitamin E was something he recommended, and at what point did he recommend that I start using it. And then the last one was how often will I have to change the dressings, and what exactly is it that they consist of. So yeah, I would have gone into all the answers to this question, but these questions, but my consult was like 30 minutes long, and we don't have 30 minutes of video. But I guess if there's questions as to the answers of the specifics, I guess I could make another video. But anyway, that's what I asked at my consult. So I'll catch you later. Hope that helps. Bye.